Hi, everyone. Welcome to the session today. It looks like there's a lot of people filtering into the virtual room, so I'll give it a couple of minutes while people join. Thank you for being here. Welcome, everyone that just joined. You are here for Creative Solutions to Community Outreach. Welcome to this session. Amy Kone and myself are co-moderating this session today, presented by Gretchen Swanson Center for Nutrition and the Ecology Center. So let's meet. We would love if you would introduce yourself using the chat, whether you are on the Zoom app or in Attendify. You can just let us know your name, information about the program that you work for, and a description of your outreach work or why you chose to attend this session today. And while you do that, I'll go over a little bit of housekeeping. I think that we are all Zoom experts at this point, but just so you know, this meeting is being recorded and it will be available on Attendify after this conference. And as I said, everyone here is a Zoom pro, but as we go, please do add your questions and comments to the chat box. We are going to try our best to take care of all the questions that you have, and we'll have a verbal Q&A at the end of the session after all three of the panelists today speak. Okay, so we are all here today to talk about community outreach. And I want to acknowledge that depending on your mission, your program goals, the community that you work with, or the community that you work for, community outreach can mean something different. And our goal today is for you to hear from three panelists on their community outreach efforts to open up your creativity so that you can take something back to the work that you do. Before we start, I have just a couple poll questions so that we can understand a little bit better about you and what you want from this session. So I'm going to launch the poll that is on the screen. What does community outreach mean to you? I'll pause while all 37 of you answer the question. It might mean building awareness, working with community members, forming collaborative partnerships, gathering feedback and insight from community members, or something else. And if you want to add something else, then please do type it in the chat. All right, and I'll close the poll in about 5 seconds. Okay. All right, so I'm sharing the results right now. It looks like the majority of you are here to build awareness for the program and also gather feedback and insight from community members. Great. Okay, and then we have one more poll question for you all. Where are you in your community outreach process? Are you starting to plan? Are you busy with the outreach work right now? Are you taking a pause and reflecting on your outreach, or are you here gathering ideas? Give about 10 more seconds to answer our poll. Thank you. All right, I'm going to close in 3 seconds. Here we go. Great. It looks like you are here gathering ideas. So that's wonderful. We can't wait to hear from you in the chat. So please ask your questions and feel free to start the brainstorm. There is the result. All right, and with that, I am going to turn it over to Amy to introduce our three panelists today.
Cool, thanks, Jenna. We're so happy you all have chosen to be on this session, and we hope it's filled with some good nuggets of information and inspiration. You can leave it feeling like just empowered and ready to try some new things, and in good company. So speaking of good company, we have three really wonderful panelists today. Victoria and Andrea and Jenny. So let me tell you a little bit about Victoria. Victoria is coming to you from Knoxville, Tennessee. She's one of those many people, like so much of us, that wear several hats at the same time. She is a data and research coordinator for Double Up Food Bucks Mississippi, which is a GusNIP grantee. She's also outreach and membership coordinator for the Tennessee Association of Farmers Markets. She's an appointed member of the Knox County Food Policy Council, and she is a former outreach and volunteer coordinator for a Finney Fundy program that was a nutrition incentive and produce prescription with AARP Foundation called Fresh Savings. Prior to this work, she used to be a director of education for the National Healthcare for the Homeless Council and an instructor in the culinary arts program at a college. She's a trained chef and a passionate foodie, which I talk to her about on the regular basis. And she is a published author of a series of contemporary fantasy novels. So Victoria is a wealth of cool knowledge and some stuff that you didn't even think that you'd hear about. Andrea Loud is from Denver, Colorado. Hi, Andrea, we're so glad to have you. Andrea is a regional community food advocate with Nourish Colorado, also a GusNIP grantee. She is an engaged member of the Denver community for over 30 years. Andrea is an amazing mom, a single parent, and she has experienced firsthand what it's like to raise a child as a single parent and having to choose sometimes between paying a bill or buying food or buying clothing, trying to get the healthy food for your child and yourself. Her struggles and her perseverance has ignited her compassion and her desire to help others to obtain food security and equity. And one of the many ways she does that is serving as a regional community food advocate. Jenny Dye, our third panelist, is coming to you from Northern California. She's a registered dietitian and project director for the Centers for Healthy Communities. She is associated with the GusNIP grantee as well. She grew up in rural Northern California, and it's given her a deep understanding of rural communities, and she has a huge passion for growing food, which many of us do. She spent more than a decade in the field of nutrition ed, community food systems, and food access. And currently, as the project director, she is overseeing several grants, I think 5 grants, that directly support the needs of individuals, community, and area farmers. When she's not busy working, you're gonna find Jenny spending time in her yard with her 3 kiddos, gardening and caring for her many animals, including chickens, dogs, and cats. So welcome to all 3 of you. Victoria, we're going to hand it over to you.
Thank you, Amy. What Amy didn't tell you is that Amy and I got to work together on that Finney funded project with the AARP Foundation. So we go back a little ways, and I'm excited to be here with you all. So I broke my comments into 3 sections. Kind of outreach evaluation, or outreach tracking and evaluation. So outreach, our goal, the program I'm actually going to talk to you about is the Finney funded program. I'm currently working in data with the program I work in now. So this is kind of some older hits, if you will. So the first part, our goal, of course, like what many people said on the poll, was to let as many people know about the program as possible. And we had a couple ways to do that. The program was statewide, so it was the entire state of Tennessee. And for you all who may not know, Tennessee doesn't look very big on the map, but it's a long way from the northeast corner to the southeast corner. So when I came onto the program, we had just lost the person who was kind of doing West Tennessee. So initially I was looking at how we were going to do outreach across the state. So we kind of put a plan in action. First thing we wanted to do was identify outreach partners. And because we were in urban and rural settings across the state, those looked a little different in each community. We had a state contact for all of the DHS offices, but we were kind of on our own to contact like the health department and other governmental organizations. And so that was kind of our first tier, were those point of contact through the health department, DHS, those things. And then we also looked at community centers, and because we were working with ARP, our ARP Foundation, we also had an interest in 50 plus folks. So we looked at retirement centers and, day programs for retired people. We were able to get into some school districts, but that was a little harder lift for this program, just the way things kind of are organized in Tennessee. Churches that had food pantries or blessing boxes, just anyone that we could talk to, libraries, which was kind of an odd one that might not be your first thought, but especially in rural communities, the library is the center, if they have one, kind of the community center library hybrid we saw in a lot of smaller towns in Tennessee. We had about, I want to say around 25 locations, like I said, spread out pretty wide between urban and rural in Tennessee. So that was kind of, to identify those outreach partners in each community. And then we had a tracking list for those. We actually did it in Smartsheet, but Excel would work to keep track of all of those. We organized it by county, so it'd be easy to contact them by county. We tried to get as many emails as we could from all of those folks, because one thing we put together was a monthly newsletter that we would send out, and we just did it by email by county to keep us under that cap for spam. If you can do it on a platform, then you would need permission from folks to send that to them, but that's kind of a more technical issue. But in the newsletter, we included new locations that were opening. If, kind of as seasonal markets open and close, we would include that information. We would just kind of talk about where we were in the program, maybe like what was in season at the local farmers market. And then we'd also include a recipe for seasonal produce. And that we were able to get some out of this book, Good and Cheap, from Leanne Brown, which you can find online. It's a PDF, it's available. Or because I had a background as a culinary instructor, I developed a few recipes for that as well. But it was just nice to put something in there. We'd also sometimes include like a PDF that they could post in their location, like a little flyer kind of PDF, just to remind folks. And one thing we did, since this was in the before times, before COVID, we did community mixers in each county, and we would invite all of those outreach partners we had identified, any volunteers we had, farmers market managers, and then if folks, if they could, we'd invite folks using the program as well, just to kind of get everybody in the same place to kind of do like a training on how the program worked, where it was available, all of this kind of stuff. And it just got buy-in from the community. And it was also a good opportunity to kind of identify champions in that community who could help do that, further that outreach work. And we would have someone do local food. We did one in one county, and like producers from that farmers market basically donated food, and we had breakfast with them with all local food. Obviously not something we can do right now. So looking at virtual options, one of the things we're working on, the outreach coordinator in Dublin, Mississippi right now, is to do a similar thing, but like a Zoom call, to invite as many outreach partners as possible to Zoom call to kind of talk to them how the program's working, where it's available, and probably the best way to do that is county by county, especially if you have different kinds of locations. With our Finney Funded project in Tennessee, we had farmers markets and grocery stores, and then also local, like small groceries. We had a co-op in Knoxville and like a small natural food store in Middle Tennessee. And then in West Tennessee, it was in several Krogers, and the program runs a little different in all this. So it's nice to do it by county, just because you'll be able to talk specifically about the locations that's available in that place. So that was kind of the way we did that. And if you have, like, Tennessee has a natural break between East, Middle, and West, so you can also kind of organize things that way. So those were kind of the big ways that we looked at outreach. But one of the things I would really consider is make sure to build that list of your contacts, which can seem like a task in the beginning, and how to set that up. But like I said, an Excel spreadsheet will work. We use Smartsheet for it when we have the opportunity to do that. But that'll help you with the next phase, which, slide please, which is tracking your outreach. And this may seem like an odd thing to do, and it was something Amy suggested when we were working, and I think it really helped us continue to target our outreach. So in a sheet, we had just an opportunity to put like what kind of outreach it was. Did we call? Did we meet with them in person? Was it an event? Was it a virtual event? How many people we talked to at that event? How many flyers we distributed? How many people attended, or how many people, if it was like a tabletop outreach, like a grocery store setting or an event, like how many people did you think you talked to that day? How many flyers did you have at the beginning of the day versus the end of the day? Just to see how much contact we had in each community. And then sometimes it would be, I just made a phone call to this person, and it was also good to see who you were keeping in contact with. So and that leads me to my last thing, and so I can wrap this up in the amount of time I have. Slide please, was evaluation. So between the tracking and kind of the ability to be in the community with those mixers in the newsletter, I would try to identify kind of a champion in each county that really would help with the outreach. So we had a champion in Knox County at the local health department. And then in another smaller county, rural county, we had basically the market manager was really our champion in that program. And they were both able to do things like earned media, and our rural person had a column in the local paper every week. I mean, she just was able to tap into the community. But what we found is, even with as busy as she was, we still weren't making progress. Like, we put all this effort into this county, but people were not using the program at the rate we had wanted. And so that gave us an opportunity to look at what were we doing in that county? What was the impact? Was it actually changing? And what we found was that our outreach wasn't the problem. It was a problem. It was a transportation issue. And that there was one market that was only open on Saturday. And that we wouldn't have discovered without someone identified in the community as the champion and tracking what we were doing against the impact of that. So I think that, basically, I think what my whole thing would wrap up as is track everything initially, especially the first year, just because then you'll be able to see that impact as you move on. And I'm sure I went very fast. So if you have questions, we'll address those at the end, and I will turn it back over to Amy.
Thank you, Victoria. It was awesome. I know this is the kind of thing we can't, it's so hard to narrow it down to just a few minutes. Andrea, you're up from Denver, Colorado. We're so happy to have you.
Thank you for having me. Good day, everybody. This is my first time on with such seem like very beautiful people. And I want to say I'm honored to be here, and I really mean that, because as she, in my intro, she talked about how me being a single parent inspired me, and it did, because I had no idea of a Nourish Colorado when I was the single parent. I didn't know anything about being able to get extra produce through my SNAP benefit. So I made it my goal, my heart, my purpose, that I was not going to allow that to happen to anyone else. So I had a hunger for it, and I was so happy to be introduced. At the time, it was called Live Well Colorado, and I attended a, um, a summit that they had back in, I believe I don't even want to try to remember exactly what date that was. But anyway, I met beautiful people there. I started looking at this food system. I started getting very interested in looking at my neighborhood and saying, there's no store here. There's, even a nearby little grocery store is still quite a ways out. And I've always loved to garden. And then when I hear about this awesome program that talks about you can go and get to your local, our partners are local farmer markets, farm stands, and some corner stores. And when I heard that you could go and double up on your fresh produce, I knew then, looking just in my neighborhood, that I had to get the word out. Um, and I love my neighborhood because my neighborhood is surrounded by all types, just like every other neighborhood. I live in a building where it's 55 and up, and then there's two other buildings around me that's 55 and up, and then there's an apartment complex for special needs and all kinds of things. And then there's school right there, and then there's multi-family units right there, and we do have some immigrants in our neighborhood. So that's what made me want to reach out. That's what made me hungry to get the word out. And I started right there in my little apartment complex saying, hey, double up food bucks. Have you guys ever heard of double up food bucks? And to my surprise, a lot of them have not. They didn't know there was such a thing. And so it drove me to say, okay, it gave me this vision that I needed to go maybe places other than standing in a store parking lot handing out flyers, handing out reusable bags that we do have, and I do love sharing those. And but I needed to go where I never saw come up on or came up in our meetings. I went to resources to get this word out to the people because it was necessary. But I knew if I just stayed in my circle, it was not going to get that far. It was not going to reach enough people. So what I did, my outreach went into neighborhoods where some people just will not go. Even during this COVID pandemic crisis that we had, I managed to think about all the times when I raised my son and all the resources that was needed and offered to me. But I said, I know things could only get better because now I'm a grandmother, so I know things can only get better. So I started contacting my police resource office. I started contacting uh, my schools. I started contacting, like I believe I heard Victoria say, the libraries. I started contacting um, the Department excuse me, the Department of Social Services. I contact the Housing Authority, and I just didn't do it over technology. I carefully mask. I practiced all the safety tips, but I actually went into the area where people were hurting. It did not hurt me to go into a housing project. And that housing project, I went into multi-family housing projects. I went into senior housing projects just to get that word out. It drove a passion in me. I watched mothers walk their children on a path, a trail that goes to the school through my neighborhood. I met them on that path in that neighborhood. I didn't just leave it there. And kind of like what Victoria was saying, I log in three different places when I'm doing uh, outreach. I log on my computer. I log on I because we're responsible for it ourselves. I must say that. So I log in. I keep a daily journal, and I log all these things down, and I make friendship with people. And one thing I learned in my sharing and outreach is testimony, your personal testimony. This is why I'm finding testimony is important in outreach because I saw a lot of suffering mentally. Nobody was hitting people mentally in outreach. You had people that literally was ashamed to be a SNAP participant. Why? Now, my heart went out to them And I remember going to one of our motels. I would go to motels because of all this pandemic. A lot of people wind up homeless, and they started moving into motels that was for homes and was trying to live. So I went there into those hotels, and the testimony that I was hearing, and I'm trying to rush because I got 1 minute, but I went into those hotels and I had to share with people the only time to be ashamed of anything in your life is when you have the help and won't use it. That's when you should be ashamed. And so I wanted to add that in there, and I think it's always important. And I do love the fact that programs such as Nourish Colorado, Double Up Food Bus program, give everyone the opportunity to have choice. Choice empowers. And I am going to always help somebody maintain that self-empowerment, that self-worth, no matter what your circumstances say and how low it looks to you. There's always a way up. And I believe that, and that's what got me so inspired and involved. And I love Nourish Colorado. Thank you. Did I go over?
No, you were perfect. You were perfect. And you are already, people are asking you questions, so I'm jotting them down and we'll come back around. But thank you, Andrea. Jenny, you're up. Thank you. I would hate to follow that one, but I know you're going to be awesome.
I want to talk to Andrea and just listen to her talk all day, actually. But I will follow up with it. So just to kind of describe where we're at, and then I know like how California kind of works with all of ours. I'm part of Chico State Enterprises, which is a center for healthy communities under them. And we cover the outreach region, and our Chico State region is listed to up to the Oregon border. It's enlisted in number 2 and 3 is their coverage area that we do programming in. And we really focus on the values of helping and create healthy and livable communities. And our 3 areas that we focus on, and we have grant funding, we're 100% grant funded in these areas, are food system, food access and outreach, nutrition education, and active living. And so our story into becoming a partner with the Ecology Center and the Market Match Consortium to do incentive program started in 2017, but we were doing outreach before for the other categories, the food access and outreach and nutrition education in these areas. So we are a prime contractor with the California Department of Social Services to do CalFresh outreach ourselves in our region. And we specifically, my team in-house does the Butte and Glen area, but we have subcontractors across up to the Oregon border who are actually doing that CalFresh outreach. And so this really helped with our incentive outreach because we have direct contact and are helping people sign up for CalFresh. We also have SNAP Ed funding that we have in-house for older adults, as well as, and I'm going to tell you all these programs because we leverage all these for our outreach, for National Council on Aging to do application assist with older adults and those disabilities. And so this really strategically, even before we started the incentive program, set us up to have a lot of our outreach partners already established because we've been working with them. This is considered a rural area. I know a lot of times people think California and they only think more Southern California. So I usually call this the far north because sometimes it's confusing for Northern California. Rural mark, so we're rural, and there's levels of rural with all these counties. So as Butte County as areas is one of the not as rural to us that we're located in. Next slide, Jenna. And so when I approached it of, okay, how are we going to do outreach? I really thought about our SNAP customers, who has that overlap with them. And excuse me if I may say CalFresh, because in California, it's CalFresh. So I'm going to try to keep myself saying SNAP. And so for us, really thinking about, we already have these networks and we're already working with our county health and human services who are doing the eligibility of the CalFresh application or SNAP applications. How can we inform them and bring them in to help us advertise and outreach for additional incentive programs that are our farmers markets? And so we are at 6 sites in 3 of those counties that I showed, but as I said before, we have CalFresh subcontractors that we also encourage them to do outreach for other market match consortium or incentive program partners that are in the further north as well. Also, we did in the past have the some more of the SNAP Ed funding. So we already had inroads with the public health to help us do this outreach with them. And so sometimes I would say, we know that some partners are supposed to have meetings, so I don't necessarily form collaborative meetings to do that outreach, but join them. And I will, volunteer to speak at their forums and different things to do outreach with it, so that we aren't necessarily forming a lot of networks. I have heard in like some other forums during this, like outreach takes a lot of time. It does. I love outreach because it's really what it is. It's relationship forming. Your relationship forming with the organizations that are also coming in contact with your community members that can benefit from this program. And so it is always wonderful to be thinking about what network can be activated to help you further the message, because they already are in contact. So food banks and different religious organizations are distributing food is a great partner as well. Really to focus though, I know that our public transportation isn't amazing. And I know we talked about in rural settings before, other speakers, that it's a challenge. And so I do a focus or direct focus outreach within that, really the 20-mile radius around where the farmers market is, because there's awareness that they aren't going to be able to travel to it. I already know when somebody's going through, they're in crisis and they need food assistance, like to bombard them with information that may be not relevant. So when we choose to do outreach just to that broader part of that may occur more on social media or things to be able to see that. But the directness is within that radius and being conscious of it. Once you get in contact with these partners, it's also important to figure out a re-engagement period as well, because there's always staff turnover. There's always different things that need to occur. So just remembering for that re-engagement, our local food, school district, it may be the beginning year that I'd be like, can you put this advertisement for our incentive program on your cafeteria menu to send out? They do that at the beginning of the school year, and then we have them to do it right at the end, because we have seasonal markets that are starting that would benefit from that information getting out again. Okay, so I have 2 minutes. This goes by fast. I would say, I know we already talked about this, but word of mouth is so important. And so our customer service right at that incentive program is really important. And we don't do this as like a marketing thing, but it's for us, the staff that are trained we try to form those relationships. And then we also tell our customers that are currently using incentive program, bring a friend, because getting into using a new program, it's scary. And like we tell the incentive programs, you're giving them a lot of information. So when you bring a friend and they become our advocates right there because of that. We also have layered in some of our SNAP Ed where we're doing tasting. So that kind of gives education on it, as well as people that don't have SNAP. They become our advocates because we explain the program, we explain what's going on, and then most of the time they love it. And then the other part of outreach is collect success stories and outreach. When I do presentations, I always have some kind of success story in my mind, because you put a real life, a human aspect. Like it's really great to talk about the program, but let's bring it down to the human level of what we're seeing. And it's amazing. And that's what we felt from Andrea. The human story of it means so much to your outreach. And it really just brings it home, I think. And I really do love to outreach for this program because it's so much of a win for people. There's so much benefiting of it. And so I think that's how your passion will come out when you're outreaching for this, makes a difference for your partners to continue to advocate for the program.
Thank you so much, Jennifer. This is really cool. I want to just give a quick observation. One of the reasons I really liked these three panelists is because they represent three different types of kind of a structure for outreach for these programs. Like Victoria's is where Victoria was hired part-time / almost full-time to cover an entire state. So she started it from scratch on her own and had to build out her network of partners across the state. And she managed that essentially by herself and engaged some volunteers along the way. And then the Nourish Colorado model that Andrea's involved with, I think I don't want to speak too much, but from what I understand, one of the parts of the model is that Nourish Colorado has chosen to hire community outreach and advocates in different communities that they're serving. And it provides, I get chills a little bit, because it provides part-time jobs for people, great for single moms, great for grandmas like Andrea now. And they even, when the pandemic hit and they realized they were going to have to shift the model and they couldn't do quite as much in person, I know that they trained Andrea and the other advocates and provided, in some cases when needed, technology that they might need to do their work. And so they worked with them. And so they had like a nice web model there. And then of course, with California and Jennifer, as I understand it, they were able to tap into Jennifer and her organization, who already did this work and already had so many of the partnerships that were needed. So they weren't having to start from scratch. They were tapping into an organization that already had this strength and all of these contacts. So there's a lot of different ways that you can strategize with your outreach and kind of find something that's going to work within your budget and within, what resources you already have in your state and where you're going. We do have one question already, and if you have questions, please post them because we do have some time. Brandon wanted to ask you, Andrea, what was essentially your message when you went into organizations and when you went into neighborhoods and housing communities? What essentially was your message and what information did you give as a takeaway?
Well, I have never been a shy type of person, so my message was my own story. My story, how, if I had this type of program and had knowledge of it, I wouldn't have suffered so much. I wouldn't have had to make those tough choices. How to do this? How can I feed my son healthy food? How can I eat healthy food? And so I was sharing my testimony, and I was able to identify with the police resource people because I used them when I was raising my son. They were there for me. So I want to keep that flowing, and they are one of the great resources to give that information to. And even when I do my emails and I have an introduction part of my email, I always put a little bit of my testimony in that email as being a single mother and having received SNAP benefit, trying to raise a child, how much that would have helped me go forward. And so I'm here to make sure nobody goes hungry. There is no such thing, I would love to say, as food insecurity. I would love to say there's no such thing as inequity. And I'm going to keep fighting until I'm able to say there's no such thing.
Andrea, thank you. And you have another question for you. So you're still in the spotlight here. Susan asks, Andrea, you talked about folks who might feel ashamed to be on SNAP, and that's precisely why we have a hard time getting community residents to step forward and be ambassadors. Do you have any ideas for overcoming that stigma?
I would first, I've been thinking about this for quite some time, so I'm happy for that question. And I would love for our human service department to not just point them in the direction of a mental facility or a social worker, but offer a little bit to themselves. I'm sure there are some social workers that would do that. Unfortunately, I did not have that social worker that would tell me it's okay. And I remember telling that young man who was crying because he lost his job and he had to resort to food stamps. And I'm like, no, 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 no. You still being a good father because you are. Even if it seems humiliating, I tell you, it's humility. You are a dad that loves his family and that will go through the greatest humiliation to make sure they eat. So, as I told him, like I raised my son and like I was raised by my great grandmother, we were never allowed to drop our heads. We were never allowed to walk with our heads hung down, no matter what our circumstances were. And I told that young man, I pushed him up by his chin. I said, you hold your head up and you be proud so your kids can see you, even in the midst of this trying time, can see you with your head up. So I reached out like my life, my testimony.
Thank you, Andrea. I love that. Victoria, I want to put you in the spotlight for a second. You and I, when we were doing outreach in Tennessee, which is kind of like doing outreach in 3 separate states, because we have Democrat section and a Republic section and like a blended purple section. So those parts of the state have strong views on SNAP and programs like SNAP, and some are positive and some are negative. And we were also with AARP, which can create some strong views there. What were some of the ways that you found your way to people that were really trusted by the community? Because that's one of the things that we're really drawn to Andrea about, is her passion, but she's also a very trusted member of her community, and that's clear. So as an outsider coming into a new community, how do you suss out, like, where do I go to find those trusted sources that can help me build awareness of this program?
Thanks, Amy. I think 2 of the biggest things, one, for especially in the rural communities, was just asking, like I spent time at those farmers markets and like, where do people congregate? Like, where's the best place to be? And then showing up in those spots. Like sometimes people were shocked to see me. Like I went, one of our rural communities, and Amy went to the same location with me before, had a like crisis pregnancy center where they had cooking classes and baby clothes and all this stuff. And they were just surprised that anybody cared if they had food. I mean, it was just like a complete, so I think just showing up sometimes is huge to be able to go to those places. And it is a little harder now with COVID to do that. But if you can, I think that makes a difference to just show up and talk about the program. And like Andrea, I use my personal story sometimes too. I was on WIC. I was a single mom with my son and took WIC. And that was sometimes a surprise, because I think looking like me and coming into some communities, they were like, well, you just have this expectation that that's not your life, and it is. But I think the biggest thing was just not being afraid to ask, like, who do I need to talk to? Like, who in this community is the person I need to go to? And in some communities, it was a church pantry. In some communities, it was the library community center. In some communities, it was the senior center. It just, to not expect that every community you go into is going to be the same. And when you have to do it in a big area like that, you really have to depend on people on the ground to give you that information. So.
Cool. Thank you, Victoria. Are there any other questions from the audience, from our?
I was just gonna say, I know a lot of times California, we think it's one color, but I do work in a rural part of Northern California that there is a lot of mixed feelings for it. The SNAP program that we're always navigating through. And so on the, application, and it leaks into the incentive side, that's why we advocated and did the tastings there to kind of switch people's view. So the farmer's market is a safe, accepting place of it. I kind of switch my incentive outreach. Somebody that supports SNAP, you would talk about the human part of that. They get to eat, like, what a great benefit. But I do switch my message and talk about the economic benefits instead and highlight that first. And our incentive programs allow us to do that. And then also as well, like a lot of times, maybe that they're more supportive of farmers. So then I would switch of like, look how much this benefits our farmers in our local economy. And just kind of knowing your audience and what I'm walking into, even farmers markets that we've started sites. I know that they aren't completely supportive, but then when they start seeing all the money come in, they are supportive, and it kind of changes their minds. So in our outreach and my role, I also try to change our farmers' minds and our farmers market organizations of why this is an important program. And so they don't have that public health view, but they start seeing it, and they start seeing it's important once they benefit financially.
Yeah, I have a teeny piggyback on that. One of like, just in my own circle of people I knew when I got the job and told them what I was doing, instantly had someone go, you know, people on SNAP just go to the gas station and buy Monster energy drinks. You know, they're using SNAP to buy whatever. And I was like, if you have a problem with it, then you should especially like this program, because it's especially designed for people to get more nutritious food. So if that's your pushback, there's no pushback for this program. So.
Mm-hmm. I love it. So it can't be totally cookie cutter. You need a few different messages based on your audience and based on your community. This is great. You guys have been wonderful. And even for me, who's done outreach for many years and has learned a lot from Victoria, I still learned from you all on this presentation. And I want to thank you guys. And thank you to all of the attendees that took your time for this past 45 minutes to listen in. We appreciate it, and we encourage you in the work that you do and learning and promoting your programs. So thank you all so much.
I want to put in a quick plug for the grassrooting session, which is coming up in 15 minutes. You can continue to talk about community outreach and engagement through that session. And echoing Amy, thank you panelists, thank you attendees, and there's so much love in the chat. So thank you for sharing that.
We'll see you in the next one.